Hello everyone, I'm Nida Kazi. I'm the head nutritionist and lifestyle expert with Team Luke, and I'm also leading the skincare vertical. Many of us have a hate or love relationship with the sun, don't we? So many of us try to avoid even the slightest exposure to sunlight by covering up completely using caps, scarves, sun coats, sunglasses, and the paraphernalia. Whereas many others, especially people living in the colder countries, they love basking in the sun by sitting on the sunbeds, on the beach, slathering a whole lot of sunscreen onto them. Now, should one be basking in the sun or not? Should we be using sunscreens or not? These are questions that have always been confusing to many of us. While too much sun exposure and use of sunscreen can be bad for us, having too little exposure can cause anxiety and depression and many other health concerns. So, balance is the key always. Getting some sunlight is not only great for uplifting our mood, regulating our wake and sleep cycle, improving our night sleep, but also it helps us to get vitamin D. Vitamin D is a fat soluble vitamin and one of the most important vitamins that our body requires. Vitamin D, in fact, can be termed as one of the hormones which helps to regulate multiple mechanisms and enzymatic function and hormonal cycles in our body. Yet many health professionals tend to ignore checking these levels unless there's a severe health condition that needs to be worked upon. More often than not, this should be related to a bone disorder. Vitamin D is activated in our body, in our skin and the gut. Vitamin D or cholecalciferol, which is the active form of vitamin D, is formed in our skin on sunlight exposure and then it is further modified by our kidneys. Inadequate sun exposure along with a poor diet are the two main reasons which lead to vitamin D deficiency in most people. Now, can poor vitamin D levels affect our skin? Absolutely yes. Low vitamin D levels are associated with a compromised immunity and more inflammation in the body. This makes us more prone to infections, bacterial overgrowth, causing a lot of diseases like acne, eczema, psoriasis, and rosacea. Low vitamin D is also a trigger for oxidative stress in the body. When you think of oxidative stress, think when you cut an apple, you leave it exposed to the air for some time, you see the browning, that is basically oxidation or oxidative stress causing the change in the color of the apple. This can translate in our body as prematurely aged skin. Now, there's no set rule for how much vitamin D one needs. There's no set amount which is standard across different people and different groups. This varies depending on our age, our food habits, physical activity, especially outdoor physical activity, how further away from equator you live, the climate, time of the year, and even the color of our skin. Yes, people with darker skin who have more melanin pigment in their skin tend to have less of vitamin D because the UV radiations are not absorbed as well, which leads to less of activation and creating vitamin D in the body. And when you're living away from the equator in the northern parts of the world, you have less UV exposure as well, because of which you have less vitamin D production. We need a fairly higher dose of vitamin D, which can help us reach and maintain optimal levels in our blood to ensure good health overall. For this, we need to include food sources like mushrooms, fatty fish, organic eggs in our diet. In vegetarian sources, there are very few options that you could include for getting vitamin D. Fish oil, cod liver oil are a few other sources which helps to get a small amount of vitamin D in our diet. But these quantities may not be substantial enough for our daily requirement. And hence we need to also supplement them externally using tablets, sachets, liquids. Your doctor can help you with a proper prescription for this based on your levels. Now, how much one needs will be determined by the blood levels of this vitamin, which you can easily check in any path lab doing a simple blood test. Now, is it important to get vitamin D via sun exposure if we are talking about supplementation as well? Yes, if you are supplementing regularly, then you don't necessarily need to get this from the sun. However, it always helps to have some sunlight exposure every single day because it helps to improve our emotional health, it helps to regulate our mood, it also helps to expose the skin, especially if it is affected with eczema, vitiligo, psoriasis, to some morning light, as it helps in repigmentation of the skin and it helps to kill any bacteria that might be there in the affected parts, which helps to expedite healing when you get some morning light every day. If you are looking at getting vitamin D through direct sun though, it is important to spend at least 20 minutes in the sun between the time of 10 am to 2 pm. And this is important to be done every day without sunscreen, and you want to try and make sure that your skin is exposed to the sun directly, not covered by cloth as much as possible. Now, if you miss out on the exposure even for a single day and don't supplement, the level can drop down to a considerable level. A whole body exposure to UVB radiation, including inducing the light pink color on the skin that you see when you're out and about in the sun, or the reddish pigmentation that you see on the skin if you're trekking and going on higher altitudes. This is called as one minimal erythema dose, and getting this for about 15 to 20 minutes induces the production of up to 250 micrograms of vitamin D or 10,000 IU units of vitamin D. While no amount of sun exposure can cause toxicity of vitamin D in the body, excess exposure to UV radiation from sun can cause other problems such as sunburn, wrinkling of the skin, and you have a higher risk of developing skin cancer if you have very prolonged exposure to harsh sunlight in the day. If you are supplementing though, you want to be careful to re-evaluate your blood levels every 3 to 4 months, because depending on your blood levels, your supplemental dosage needs to be changed. Now, should one use sunscreen when you're exposing yourself to the sun? We are learning about how vitamin D is important and sunlight helps us to get that vitamin D. But then again, would it help to put on sunscreen? Now, one common problem associated with the use of sunscreen is that when people use sunscreen to prevent sunburn, they often extend their time in the sun and increase the exposure to the UVA radiation. UVB radiation make up to 3 to 5% of the ultraviolet spectrum of the radiation, which are important for vitamin D activation in the body, whereas UVA rays are more prevalent in the sunlight and penetrate the body deeper. These rays tend to be more harmful and they are also known to cause genetic mutation, which makes us more prone to illnesses and different kind of cancers. Sunscreen is known to block the UVB radiation, which is why it is better to avoid them if you're trying to get vitamin D through sun. Apart from this, many sunscreen have harmful ingredients such as oxybenzones. You also want to check and avoid ingredients such as paraben, lead, and petrochemicals. You want to go for a trusted organic brand which clearly mention what is included on the label and avoid any of these harmful chemicals in there. So the conclusion is, if you are using sunscreen, it is important to choose the right one and opt for a lower SPF, and don't over rely on it for your total protection. If you are going to be out and about for more than 20 minutes in the sun, you can use other ways to protect yourself from excess sun exposure, such as umbrellas, such as scarves, covering up as much as you can. I hope I am able to throw some light on this very important topic of vitamin D and why it is so important to our health and why it is important to keep checking your levels regularly. If you have any questions, feel free to reach out to us and we'll get back to you as soon as possible. I hope you have a great holiday. Wish you all a happy Republic Day. Take care.